Our first speaker at nine. I'm sorry. All right, so this is Ledge Committee for PABEA. We're going to start with our first speaker at 9:31. And our first speaker is the ever famous Representative Lisa Martin, Chair of Human Services and Homelessness Committee, correct?
That's right. Thank you.
Okay. And can you hear me okay?
I can hear everybody fine.
Okay, go ahead. Share with us houselessness and
Okay.
Kapuna and what kind of bills you think are going to happen and anything else you think we should know.
Okay. Okay. So again, I represent District 51, which is Waimanalo Kailua. And I'm going to talk to you about three bills that I'm introducing. I don't know what all the bills are. Actually, I did get a look at the Kapuna Caucus bill and I did get a chance to vote on those, but I will not share those because I'll let them share that with you. But the bills that I am introducing that are connected to Kapuna interests, one is a long-term care financing task force, which is something I don't know if you have had a visit from Melvin Sakurai at any point to talk about this.
Nope, we
I'm
haven't.
here, Lisa. I'm Marilyn Seeley.
Oh yeah, yeah. Okay, there you go. So yeah,
Yeah, so I've talked to the group about it
okay,
probably
yeah.
for the
So
last 30 years.
yeah, so this has been a long time coming, and I think if we are able to pass this bill, what would happen is there would be a legislative sanction task force to look at it and come up with recommendations, and that might have a little more weight for taking action in the future than all the good suggestions that have come in from individuals interested in this area that are, kind of um, good govern, good Samaritan lobbyists of a sort. So hopefully this would have that more of a weight that would allow us to move forward. So just a task force, but it's a first step.
Yeah.
So that's really exciting because as our population ages, it's just going to become a bigger and bigger financial burden that we need to figure out how to pay for.
Will
And
that be a
then,
new bill this year?
I'm
Will
sorry?
that be a new bill this year or?
Yes, it is a new bill. And I think Senator Moriwaki is introducing it in the Senate, and then I'm introducing it in the House.
Okay.
And then another bill that I'm very excited about, and I hope will be a majority caucus bill, is for the Hawaii Benefits Hub, which is a name that I just made up. But that is that would benefit Kupuna, but it would benefit everybody who gets social assistance and participates in any sort of benefits administered by the state. And it was inspired by the new work requirements that are coming up for Medicaid and the expanded work requirements for SNAP, which used to apply only to people until they were 55 years old or 54 years old, and now it's going up to 64. So you cannot get SNAP unless you show community engagement, and that will be the same for Medicaid, for public housing, federally funded public housing. So all of these are, going to have these new work requirements for people who are considered able-bodied and without dependents. You can be exempted if you are caring for a child under the age of 14, so 13 and below. It used to be for SNAP that you could have a child up to 18 and not need to work, but that has changed. And with the new regulations for Medicaid, right from the get-go, they will start with needing to have a 13-year-old. And again, the age at the top. You can also be caring, if you are caring for a disabled or elderly person, you can also be exempted. So there are exemptions for, particular groups. Homeless people are no longer exempted. So there's a lot of concern on my part that people will not be able to stay on benefits because they won't be able to meet that requirement. You do not have to necessarily have a job. It's pretty complicated because the rules are different for different agencies. But you can be in school half-time. You can be, the hours are 80 hours a month, so it's kind of like a half-time job right? So you can be working, you can be in school, you can be in a training program, and you can be volunteering. So you can imagine if you are getting your 80 hours a month together through a variety of different activities, it will be very complicated to document. And in some red states where they have voluntarily in the past put work requirements on their social service programs, what they found is a lot of people who actually qualified, were eligible for those programs, lost the services because they were unable to document it. So this Hawaii Benefits Hub is basically using a big statewide data portal, a master data system with AI, to allow people to go into one place to see what they qualify, all the different state administered benefits that they might qualify for, upload documentation one time, and have all the agencies on their part not have to gather all that data in a redundant way, each agency. But for the agencies, they can have some cost savings because they can dip into that data pool and check eligibility. So for kupuna and the disabled, we've heard in the past a lot of frustration about the need to reapply and re-verify and the burden that that places on people that for whom, that's not easy. So this will really help with that. A lot of the data will not be uploaded or offered by applicants. It can be gotten from other sources, like from income data, from DOTAX, from schools, etc. So the last source of data will be individual applicants. The first sources of data to see if people qualify will be gotten from other databases to minimize the burden on individuals. So that's one bill that hopefully will be a long-term one. It's inspired by these new work requirements that will be very complicated to document, but the benefits do not stop there. And should the work requirements be reduced or go away in the future for some of these benefits, this will still be something that will make it easier for people in our state to access benefits, streamline the application process. And then the last one that I wanted to share with you is one that I tried last year. It made it to conference and didn't pass. And it is basically, there's a lot of nonprofits that provide social services to a variety of groups in our state, including the elderly, from DHS contracts that are arguing, in my mind, very, very rationally, that their contracts do not cover the cost of providing the service. And these are services that the state, in some cases, is federally mandated to provide, like checking in once a month on foster families or things like that. And in some cases, it's just a stated state priority, something that we value and want to do. But instead of having our own staff at DHS, which, as you know, it's very difficult for the state to hire and retain staff, we are outsourcing that state work through contracts to nonprofits like Catholic Charities, etc. And so it's a bill to increase the amount of the contracts because they are getting paid the same despite rising costs, right? Despite the minimum wage has gone up, so their labor costs have gone up, the utilities have gone up, gas prices have gone up for those that pay for transportation, their rents have gone up. So everything's gone up and their contract amount has not gone up. So that's another one. And again, that would also include adult protective services, among many other DHS contracts, which is obviously an important service for kupuna. So those are the three, and just end it there and see if you have any questions.
Okay, Jason, we have one chat there. Okay, something about federal.
Oh,
Let me look at the chat real quick and then Marilyn has her hand up.
oh yeah.
Oh, I see. Their question is, are these federal work requirements? Yes, they are. So it's all federally imposed on our state. It is not something that our state wants to do.
Okay.
Lisa, this is Marilyn. Thank you very much for this. It's very interesting. I think the collection of that data is an absolute horrible nightmare. So anything that we can do to help, it'll still be very difficult to do, but it certainly is easing it for people. And, having a disabled husband at home, I just can't even hardly imagine this, but in any event, I know you're trying to do what you can. What is the definition of able-bodied? I think that's crucial.
Yeah, so it's actually quite complex for each agency. It's a little bit different. So for example, there's many groups that are exempted, like pregnant women are exempted. So it's adults 18 to now 64 that are not disabled. So you have to have a doctor determine that you are disabled, or a medical professional. I don't think it has to be a doctor, but a medical professional has to determine that you are disabled. You could be exempt. If you are a care provider, a full-time care provider for a child who's 13 and younger, or a disabled person, then you are also exempt. So there are exempt groups, but some of the groups that were formerly exempt for SNAP are no longer exempt. So for example, people between 55 and 64 are no longer exempt. People who are homeless are no longer exempt. Formerly incarcerated are no longer exempt. So there's a lot of groups that are not exempt anymore. And those might be groups that are particularly difficult to employ, right? So another bill, which I didn't mention, is looking to beef up our volunteer opportunities so that there are places for people to go that maybe are not particularly employable to go and clock hours if they need to do this. Because you can imagine for some people, they are getting SNAP and Medicaid and public housing. And to lose those is, it will be an enormous cost on our state. Like we will pay one way or another, right? So if somebody loses their Medicaid, we will pay in the emergency room. If they lose their housing, then we will have to provide housing. So, the state will pay for it one way or another. So I'm looking to beef up, help our nonprofits that are able to provide volunteer opportunities, like for example, the food bank that has locations that are convenient because they're all over the place, to perhaps beef up their opportunities for people to volunteer and clock hours that are, meet the requirements.
That's wonderful. I want to thank you very much for supporting the long-term care financing bill. That is so crucial. We've tried for so long.
I know.
Finally,
I'm hoping we can see
other
it.
states are picking it up because, this is the way to go. And I thank you very much. It's a difficult time to do it, but we know we have to start now if we're going to have it set in place within a few years. And we're looking forward to a brighter future politically. Thank you so much.
Aren't we all? Thank you. Any other questions, or should I let the next person go?
Questions? Anybody?
I just had a comment.
Yeah, Carolyn.
Hi, Representative Martin, it's Caroline Cuddy Rao. Volunteer opportunities for those 55 and older. There is a retired and senior volunteer program in each of our counties. We have volunteer opportunities here at the Executive Office on Aging. So, of course, people would need to be screened and, find a good fit, but just wanted to throw that out there that, if there's anything we can do to support that.
Yeah, so what I had envisioned at this point, it's still a work in progress, is something similar to, basically we would do outreach. The information is coming to me very slowly because the information is coming to our agencies from the federal government very slowly, right? SNAP fortunately got a bit of a reprieve. They were supposed to implement these expanded ABOD requirements in November, but they got a stay for 6 months, an exemption that they applied for, a waiver, I guess it was called, that was only available to Alaska and Hawaii. So that moves it off till May. So there's a little bit, they don't have the best information, and I'm therefore definitely not getting the best information. But basically we want to make sure that in the short term, because my bill will not kick in and solve these problems in the near term. So in the near term, we want to make sure that all existing programs have a way that they find legitimate to document those hours. And the number of hours is incredibly high, right? 80 hours a
Yeah.
month is very high. For Medicaid, actually, only for Medicaid, there is the option to show income instead of hours. And that income, so like if you were an Uber driver or whatever, right, and you have income, it wouldn't have to be tied to hours. It's tied to the federal minimum wage, which is only $7 and something an hour. So if you can show income of 500 and something, forgive me for not knowing the exact numbers, but I don't remember them. So 500 and something dollars a month, for Medicaid only, that income can be used in lieu of documenting hours. So for some people, that might be a great way to go. But yeah, I'd like to, once I get better information, we'd like to have all volunteer programs in the system and somehow, legitimized to be documenting hours and know how to do it. But the bill that I'm talking about would be additional funding for those that want to expand those programs and provide, hopefully not to replace existing funding, but to either start new volunteer programs that are in places that are convenient, like in homeless, housing or things like that, or expand existing ones. And that could be for staffing and stuff. And that the vision is to make it a little bit like our Act 32, which set aside a pot of GIA funds for nonprofits that didn't know yet how much federal funding they were going to use. Once they knew how much they lost, they were able to apply in the fall for this special fund. So not $50 million, I won't be able to get that. So it would be a smaller fund, but set aside specifically for organizations that want to expand or start volunteer programs with these populations that might need to document hours. And that fund would be set aside for them to apply for in the fall. And, so they might hire a volunteer coordinator or something like that, right?
Yeah.
So any
Okay.
of those senior programs that wanted to expand, hopefully that could be an opportunity for them.
True. Great. So I see Marilyn has two more questions and then we'll wrap up.
Okay.
So she says, you probably see it there, definition of able-bodied.
Got
And the
that one
second
already.
question.
Oh yeah, I can send you folks my chart.
Okay.
I can't tell you how difficult it's been to get information. I can tell you right now that for Hawaii Public Housing Authority, their situation is a little bit different. Trump has said he wants work requirements for public housing, but they haven't, it hasn't, I don't think Congress has approved it yet. And so they assume it's coming. And what they're planning to do is to beat the federal government to it and set up their own state requirements. Because if you have a state program, they may give you a couple years before they impose the federal rules. So they are planning to do a 60-hour a month program, hoping that then that will prevent the federal government from requiring the federal rules. So that's a little bit complicated, but so they have not yet defined who needs to do it and who doesn't, or who is exempt. But for SNAP and for Medicaid, they're slightly different, and I can send you my table that I've been trying to get information into as it comes.
Okay. Can you also, when you get the bill numbers, send those over or have your office send those over too?
Yeah, absolutely. And again, those bills are not exclusive to seniors, but they're for everybody who needs help.
Yeah.
Yeah.
Well, then Marilyn has also on there, and I worked with this, how do folks with mental health meet this requirement or are they exempt?
Well, it depends. If they are considered disabled by a medical provider, then they are exempt.
Yeah.
Yeah.
So I'll throw in,
But I heard like if I've because I've asked, I said, well, what if someone is like really has anxiety problems and they can't hold a job, they freak out or something? Does that count? And they said, oh no, that doesn't count. So, so you have to have quite serious mental health problems to be probably to be to have somebody write you a letter saying you're incapable of working.
I'm-
Marilyn, I
I'm-
can't hear you. I see your lips moving.
Oh, can't hear. So I'm retired from, so one of my roles is mental health is disabilities.
Mhm.
And so just for the record, you have to be unemployable for 2 years and it has to be documented by a doctor with a disability to qualify. So I don't know if that's changed at all with this administration. So that's a long time to go with mental
Yeah,
health.
I haven't heard anyone say anything about a 2-year waiting period. So I hope that is not the case.
I don't know
But
either.
but again, I'm just desperately trying to learn. So I appreciate you bringing that up. Now I know
Okay.
what to ask. Thank you.
They
Dean,
just, mental health people don't go to the doctor to get verification either in many cases. I wish some of these people at the federal level would go down into the community where people are hurting and say, we're not all cheaters. We're not going to the grocery store to buy lobsters. This is not where the issue is. The issue is unscrupulous people who file false claims. And that's where most of the money is going that is illegitimate. And we're
You-
not addressing that at the federal level at all. We're blaming it on the victims,
Yeah, you know
down
what,
at the
Marilyn?
level.
I don't think that's what it's about. I don't think it's about fighting fraud. I think it's just trying to reduce the number of people who are on these services to cut the budget. It's just
Well,
about the federal government saving money, and I think they really don't care.
They don't know and they don't care,
I
and they're
think they
not,
mostly don't
they're
care.
totally clueless, absolutely clueless. They
Yeah,
need to
I
get
just, I
down to the
literally,
community.
they actually may be very well informed. That I wouldn't agree with. I think they know what they're doing and they're doing it on purpose.
Yeah. Well,
Yeah.
that's
No,
very,
so-
very
so
distressing.
we're recording all this, so we're gonna stop that.
Yeah,
And really appreciate everything you've shared
Thank
here.
you.
Those are incredible bills. Rep, so, and appreciate you coming in and joining us today
Yeah.
also. Is there anything in closing you'd like to add?
No, I just appreciate your work and I appreciate your advocacy. And I
Okay.
hope to see you folks testifying this session.
Absolutely. Okay.
Aloha. Bye.
thank you.
There's a comment there.
Yeah, we.
Yeah, there's a comment there that
Thank
I
you
think
for
you put
coming in.
it in, yeah.
Okay.
We'll make sure we keep all the comments too.
Yeah. Well, so reader comment then, person is not able-bodied under SNAP or housing rules if they
receive
receive Social
SSI
Security, SSDI,
or
or,
certain VA disability benefits. Oh, thanks, Daintree.
thank you.
Thank you.
She might be joining us later, right?
that's helpful.
Yeah,
That might have been helpful for.
okay, I'm
For Red
wondering where
Market.
Kobe is, if he's outside or something.
Oh, I'm wondering. I can check.
I thought he
Is
was
he,
coming first.
is he on the, is he the iPhone? Oh, there he is. It's right there.
There he is. Oh, okay. Oh, okay, so our next speaker is here. So we'll just start with Kobe and then afterwards we can have discussion. Is that okay? So, Kobe Chalk is with Alzheimer's Association, and I'll let you tell him your title and everything. I will share that myself, Kathy, and Barbara, we do a lot of stuff with Alzheimer's Association also. Kobe has a few bills to share with us, right? There's a few bills.
So
And
we
then-
have a few bills, and do I have permission to share my screen? I can show a couple of graphics so it's easier to follow.
Okay,
Go ahead, let's
Jason, we'll
see.
set you up there then. Hold on. Okay. Okay, I
All
think you're
right.
good.
All right, yeah, thank you everyone for your time here. I'm gonna go through a few of the bills we have this year. Doing a few things, but this first one here is really to expand access to memory care, clinically and in the community for those across our state. And it's called the Hanai Memory Network. It stands for Hawaii's Assistance for the Navigation of Alzheimer's Intervention. And it would provide statewide access to early detection, treatment, and long-term dementia care. And the way this works is it has two components that are primarily stood up through this bill. The first is a state dementia care specialist, and they would be embedded in each county within the Executive Office on Aging. And this dementia care specialist would be either a licensed social worker or registered nurse, someone who's qualified to do mini cog or a brief cognitive assessment and kind of talk with families about what situation they're experiencing. And then the second component is a memory clinic. And these memory clinics would be contracted with health systems and based in each neighbor island county. So you can see in this map here, one would be on Kauai, one would be on Maui, and one would be on the Big Island. Oahu doesn't have a memory clinic in this proposal because the Queen's Health System, along with Hawaii Pacific Health and many other um, health institutions that we have here, have the capability and system set up that if someone in private practice or outside of their network has memory concerns, they can be referred to them, and we have the facilities and capabilities here on Oahu. So this is largely focused on providing access to rural areas and neighbor islands. And so these memory clinics would be staffed by at least one doctor, whether it be an MD-DO or it could even be an EPRN. It would be staffed by one registered nurse or MA and one licensed social worker. And these are all individuals who are trained specially in memory care. And so as you're all aware, when you come into a visit, the doctor will likely do their part. The registered nurse would assist the doctor, and then when you have people living with dementia or Alzheimer's, there's often a component that deals with the family being involved, and so the licensed social worker can interview the family and work with them as well. So this team of specialists can do a few things, including doing an assessment and creating a care plan. And so there's two ways into this network. First is um, the dementia care specialist. So say someone in the community is calling in because maybe their dad left the stove on a few times. Maybe someone wandered off a few times. Maybe they're just realizing that there's some small changes happening with the loved one, whether it be them losing their keys a few times or being slower to process certain things that used to be quick to them. These are things that the dementia care specialist can do an evaluation at the person's home, in the community, or over the phone and kind of determine what the situation is. If the person is at a later stage where maybe they have a diagnosis and an assessment, but and they have a care plan as well, but maybe the family's calling in because the family member who has dementia is wandering off, and it's something that maybe they're burnt out. Because caregiver burnout is a real thing, and so the dementia care specialist can connect them with resources such as the Alzheimer's Association for caregiver support and kind of tips and tricks to help them to be able to manage this case. But then also they can refer them to respite services and funding through the county or other nonprofits. We have some respite funding that's going to be going out very soon as well. And in addition to that, the dementia care specialist can also realize that, okay, maybe this person doesn't have a care plan. Maybe they weren't assessed at all, but maybe they are having some cognitive changes. And that's what they would do the mini cog or brief cognitive assessment. And depending on how they feel the situation is after this brief evaluation, they triage them. And if they determine that they do need clinical care, they can refer them to these memory clinics. On the other hand, on the neighbor islands and even on Oahu, but especially on the neighbor islands, you have a lot of PCPs in private practice. And about 40% of PCPs weren't trained on dementia when they were in medical school. And about 60% of PCPs aren't comfortable making a diagnosis of dementia. I think largely because they weren't trained on dementia care. Another component is even if they were trained on the neighbor islands, because of the caseload of PCPs just really across the state, they don't necessarily have time once they have a diagnosis or something that seems like it might be dementia to do a thorough assessment and then go to a care plan. So they can refer to these memory clinics even if they're in private practice and they're not part of this other system. So these memory clinics, as I mentioned, are part of a larger health system that is contracted with the state, and they would do this assessment and care plan. Once the assessment and care plan are done, they can then refer them back to the PCP now with the care plan in hand. They can refer them to geriatrics for further diagnosis, treatment, holistic or end of life care. Or finally, if the person is in an early stage, maybe a mild cognitive impairment or mild dementia, they can refer them to neurology. And the interesting thing and cool thing about this is because the memory clinics are in partnership with a major health system, if they need to do a neurology visit, they can actually do this visit via telehealth, and the patient doesn't need to necessarily leave the island. With the new developments in blood-based biomarker testing for the detection of amyloid plaque, a hallmark of Alzheimer's disease, the blood test can be done in the memory clinic, and therefore the patient, again, doesn't need to travel to Oahu for a diagnosis of Alzheimer's disease or ruling out of Alzheimer's disease, which is equally as important. The rationale behind this is really that with the new treatments that are available, it only works, and these treatments slow down the progression of the disease by removing amyloid plaques. It only works if individuals are diagnosed in the early stages and reach treatment quickly. This provides equitable access to treatment and care, and really supports providers and caregivers across our community. Our state spends $309 million per year in Medicaid for people only with Alzheimer's disease. So that's not including all the other diseases, but for people living with Alzheimer's, it's $309 million per year. 5 years ago, that number was about $240 million per year. We're expecting that the population of folks living who are over 65 to double from where we are now. So we are expecting this number of Medicaid spending to go up as the cases of dementia and Alzheimer's goes up. And so essentially, with the cost of long-term care and frankly, shortage of long-term care beds in the future, especially memory care beds and skilled nursing, um, it's pretty expensive. It runs about 15,000 plus per month. I think on the Big Island it's closer to 20,000 a month. If you're paying on your own, and through this private pay option that would come out to about between 180,000 $200,000 a year, maybe more if it's on the $20,000 end. And so if the families can't afford it and then they spend down and go on Medicaid, or maybe they just don't have the funding available right away, you either have to decide whether someone's going to quit their job and leave the workforce to take care of this loved one, or leave them at home alone, which is dangerous, or the state ends up paying for it, and the state is paying. That's where you go back into that Medicaid pool of 309 million that we pay now. So this annual budget would run about $3 million per year for the first few years. After the health systems are able to stand up this clinic with the seed funding, they can bill for services to Medicare, Medicaid, and commercial plans. And then this annual budget will go down to 1 million just for the dementia care specialist. And that is this priority. Before I move on to the next one, this is the most comprehensive one that takes some time. So I wanted to stop for questions here.
There is a question in the chat.
Marilyn wrote, is this an initiative currently under the rural health budget from the federal government? You see that question?
Yes, I do. So it is not in, it wasn't in the proposal for this. Um, and I can't speak to exactly what this is going to look like because I know the funding is still going to come in and then it can be used a few different ways. And I know that there's also, aside from the blanket amount that's coming in, there's going to be some more like discretionary funding coming in. So I'm not sure. But this isn't in the initial proposal for the rural health uh, transformation grant.
Okay,
I have a question.
okay. Sarah's gonna ask a question.
Hi, Sarah Maderas from Kona. Just a comment, really. I just want to, I'm concerned when I hear about a memory clinic for the Big Island. One, it's 100 miles from one side to the other. And it's unlikely that families are going to load themselves, load everybody up and drive 100 miles. Maui, of course, is made up of several islands. And although we're talking about telehealth, there's nothing like, especially for a clinic. Is there a possibility of thinking about a mobile memory clinic so that that person can move from point A to point B or service an island that is quite diverse and big, or multi-islands?
Yeah, so that's a good question. And really, this is seeking to bring the specialty care. So it's not so much for primary care. So they're not going to be doing cognitive screenings and assessments when people come in for an initial visit. This is for if the initial visit shows that the person has cognitive decline, then this is the next referral because currently they either don't go anywhere or two, they have to fly to Oahu. So the initial plan is to have one memory clinic on each island, so that way at least it's drivable and not flyable. And the long-term plan is after this initial round starts up with one per island, we have spoke with some senators who actually think that, maybe we should add even more than just one per island. So I think the plan, if this goes well, is we would add one more to the Big Island. So we might have one in Hilo, one in Kona, maybe even one in North Big Island, so like Queens North. And then same thing with Maui. We have, of course, uh, very spread out populations there. And so I think the plan is to initially start with one per island just as kind of a pilot, and that way it provides access to memory care on the island first. And then once it's proven, and then there's some sustainability, because the clinics, again, is $3 million, 2 million go to the seed funding for the clinics to start up. Once that money pulls off of those initial clinics that already started up, then the legislature can either decide this program is working, let's reappropriate, let's keep the same level of funding to start new ones in additional locations, or we can roll it back. So I think that's the ultimate plan, to have enough dispersed throughout the island so that you don't have to drive a ridiculous distance. And even on Oahu, seed funding to start some on, I don't know, the west and the northeast part of the island would be beneficial. So this is just the start, and there is definitely thought to further expanding so that we have even more coverage.
Okay, very good. Any other questions on that one? Okay, all right, Kobe, next.
All right. So the next couple are a little bit simpler. The first one that we'll go into is um, the bill that is going to be introduced by Kupuna Caucus this year, and it is a bill for this header thing is in the way here. It's a bill for dementia training for first responders. And so we don't have the bill numbers for this yet, but as we all know, people with dementia can easily become lost, anxious, afraid, agitated, and aggressive in some cases. And so 90% of people living with dementia will have behavioral and psychological symptoms of dementia. And we all know there's an increasing number of and intensity of wildfires. There's 1,248 ER visits per 1,000 people living with dementia. We have 31,000 people living with dementia in the state, and it's going to double in the next 25 years. And a lot of people living with the disease live in the community. So it's important that our first responders are trained to handle situations such as these through training, because if there's a fire and there's smoke, it's hot, the person living with dementia is already going to be panicking and stressed. And if you have someone who then comes busting their door, even if it's to save them, they might not understand. So it's important for our first responders to be aware of um, how to best handle cases like this so we can keep our kupuna safe. And the training would include understanding dementia, communication strategies, de-escalation techniques, public safety protocols, and basic tools for crisis management. And our Alzheimer's Association does offer this training online for free. So it's about 1 hour, a 1 hour course. They can do it annually online, get a certificate. Some departments have been using this, others not as regularly. But it is free, and then we have been doing trainings in person with the new recruits at HPD as well. And we've had this ongoing every new recruit class they've had us come into a presentation. So we just want to make sure there's standardization so that everyone across the state is trained and capable of keeping our kupuna safe. Any questions about this one?
Well, I see one that kind of dovetails with the last one too. So is the
Okay.
plan for PCPs to do initial determination to refer to memory clinics? Won't PCPs need training?
Yeah, so PCPs would refer to the clinic as well as the dementia care specialist. And when it comes to the training, you're right, a lot of PCPs don't have the training in it. However, the cognitive assessment that most PCPs use is called the mini cog, and it takes 3 to 5 minutes, and it has instructions on the paper on exactly how to administer it. It's really recalling 3 words. You list 3 words out, the patient says what the 3 words are, they draw a clock, and then after that they you ask them what the three words are again. And that's the extent of what they need to do for just a cognitive screening. That being said, we are working with EOA and developing a toolkit that has a bunch of these cognitive assessments available, as well as the continuum of care, so that after they have a positive screening result, what resources do they have to go to currently? So we are working on that, and hopefully going to have that out to help train the PCPs and provide the resources that are necessary to do what this is really intending for them to do. And so um, that shouldn't involve comprehensive retraining, at least for the mini cog, and that's kind of the idea. They can do something very simple and then refer to the specialist from there.
Okay, thank you. What was your next one then, Kobe? Or any other questions on that one?
Maybe just,
Identify yourself.
sorry, hi, this is Shelley.
Thank you. Thank you.
Just wanted to, maybe it's not totally related, but wanted to see how the dementia training would dovetail with the silver alert issues. And then also for the PCPs and the reimbursement for their services, we have huge issues with that on the neighbor islands, and I'm sure also on Oahu. So just trying to wrap my mind around how that's going to be addressed as well, because that's integral to a lot of this, right?
Right, right. Okay, so let's start with the first one. The Silver Alert, Department of Law Enforcement put the Silver Alert uh, website, they call it Safer Watch, online. So it is active where a caregiver with a loved one living with dementia can go and register their loved one on that website. And the registry that's being created is really seeking to have the background information of the person with dementia in advance of any sort of um, wandering, so that the family puts in information, maybe height, identifiers, where they live, where do they frequent, that kind of thing, as well as a picture, so that in the event that someone with dementia goes missing, the family can go to the Safer Watch app or website and make the report that they're missing there, which then goes to the Department of Law Enforcement, who can activate the Silver Alert or get to the appropriate agencies to find them using the identifiers that are already there. So it's just more efficient and a little bit uh, quicker in the response rate there. But in terms of the activation of that program, it hasn't started yet as far as we are aware. The idea with the first responder training here is that one, it can help to address situations that maybe someone does wander and then is found either because of the silver alert or even without the silver alert. When people wander off, sometimes the family doesn't even know. There's been cases where they wander from long-term care facilities, or the family might be at work and leaves them alone. We have a lot of people living alone with dementia and Alzheimer's, and so when they wander off, and the police encounter them, maybe in an agitated state, the signs of what dementia is, and that this could be dementia, not some other mental health crisis or drug issue, is really important, even for other diseases similar like Parkinson's, where you sometimes have behavioral issues, and you've heard of cases where people aren't treated properly because misunderstanding of Parkinson's versus some other violent issue. And so that's what kind of how this ties in. It's not gonna um, necessarily be training specifically on the Silver Alert. Hopefully, it does help with helping to find people living with the disease, but this goes more to the other side of people who are unreported, who just might be out and about and are in a crisis event.
Daintry's asking what the name of the platform is again. She didn't understand the name.
Yeah, it was Safer Watch. So it's on DLE's website. Um, After I finish up here, I can find the link and put it in the chat so that you can all see it. Thanks, Sheree. So then, because I know I had a hard time finding it at one point, so I'll try to dig through and find it. I could put it in the chat after this.
Okay, then we put it in our note chat.
And then the
Okay.
second question was about reimbursement, I believe.
Right.
First, so that's an excellent question and something we are actively working on as well. Reimbursement isn't what it needs to be, especially for cognitive health. So the only way that providers currently bill for services for cognitive health are one, through the annual visit. We passed the bill last year that requires cognitive assessments be used at the annual wellness visit. So when doctors bill for the annual wellness visit, that's a part of that billable service. But when you go and look at people who aren't on Medicare yet, um, there is no coverage for cognitive assessments unless the provider just bills for the generic additional time. So the only way this happens is if the provider deems that the person has significant cognitive impairment that is often going to be representative of a mild stage of dementia at best. They're not going to use the extra time billing code to bill for these services. So that is an issue. And then the other side of it is if someone comes in with Alzheimer's disease and says, I have cognitive impairment or something like that, then they can use the additional time as well. And if they come in otherwise, then the local style is the doctor asks, how are you feeling or how are you doing? And everyone's like, oh, I'm good. Most people don't like to highlight the issues that they're having, even if they have it, and especially cognitive issues that have this sort of um, negative connotation attached to it still. And so the proposal that we have that's going to be a resolution this year is a sunrise analysis for the coverage of cognitive assessments for the purpose of screening in those over 50. And the reason for this is because people living with Down syndrome are at a risk for Alzheimer's disease, much higher elevated risk, and especially at a younger age, where we need to be catching it sooner than later. We can't wait till they're 65 to diagnose. And this goes for other minority ethnic groups as well. So we know that in Hispanics, Blacks, Pacific Islanders, that the risk is often higher. And there's a report, I think it's a meta-analysis from the University of Hawaii that showed that Hawaiian people, um, were diagnosed in this collection of data at a younger age. And even when they were diagnosed at a younger age, they were at a more advanced stage. So it wasn't the mild cognitive impairment they're catching them at. They were in already the mild dementia stage. And so this is kind of the rationale behind this cognitive assessment insurance mandate. It's a brief cognitive assessment. It could be the mini cog or something similar. And it'd be a billing code similar to that of the mental health screening that is already covered. And you might see it when you go to your annual visit with your doctor. They ask you, how are you feeling? Have you been depressed in the past so many days? How many days? They do that because that is a billable service. So we want to make cognitive assessments a billable service for PCP so they can get reimbursed for doing this thing that's so important to those in this high risk group that aren't quite yet on Medicaid or Medicare. Sorry, Medicare, not Medicaid.
And you had one last one there, Cody?
One last one. So this is a little bit less relevant directly to Kupuna caucus, so I'm not going to go too far into it. But with the help of Dr. Masaki, Dr. Kazuma Nakagawa, Abraham Chung, and then Poki'i here on the call, we worked with the University of Hawaii to uh, draft the report on establishing an ADRC, Alzheimer's Disease Research Center here in the state. Right now, we don't have really much happening in the Alzheimer's space. We have some grants that we received in the past. There are over 400 NIH grants for research and trials in the nation. Hawaii leads on one. It's the HULA study on how HULA benefits or how HULA affects dementia and its outcomes. So this ADRC designation comes with up to about $3 million per year from the NIH for research. And the only way we can get to the point of applying to be an ADRC, and this is in addition, sorry, to additional grants that they get for specific research, but the only way we can get to this base level of $3 million per year through an ADRC designation is by having an organized dementia research unit. And so this plan kind of outlines the funding that we've had in the past and then some of the benefits that we have. We have one of the largest brain banks at Kuakini in the entire nation, so we could really benefit from that. And then it has a phased timeline. So this first year, we're looking to establish an Alzheimer's disease research unit at the university and hire two positions, one senior clinician scientist, and then one program or center coordinator. And then year two, we add I believe, one or two more positions. Year 3, we had one or two more positions. Year 4, we're kind of into the research now, and then year 5, we apply for the NIH ADRC designation. So you can read this report. I'll share this in the chat as well, so you can kind of read up on it on your own. But that's the final priority because that'll bring more clinical trials here and provide more opportunities for those impacted here in both the early or pre-Alzheimer's stage through later stages to access the latest in treatment and make sure that our population is represented in these national trials.
Okay. Any questions for Kobe? Any other ones?
One question,
Okay, Bill.
what's the percentage of professionals in this area that are, there's a shortage of professionals to handle Alzheimer's and stuff like that in Hawaii? Is it a critical problem or what?
I would say in the neurology space, it is a bit of a critical problem because we only have so many neurologists in the state, and of those neurologists, there's all different specialties, right? You have, stroke neurology, and then you have cognitive neurology, which is a subset of, the other types of neurology. So, the cognitive neurologists in the state, I would say, is less than 5. We have 3 that I know work very intensively in there. One at Queens, one at HPH, and one at Hawaii Pacific Neuroscience. But beyond that, you have general neurologists, which are okay, but not as good when you're looking at treatment of these new diseases using the latest in treatment. So we could use more neurologists. The plan is that hopefully through the Hanai Memory Network, we can recruit more neurologists to come in because one of the things that we've been hearing is that while some people want to come here, there are no jobs. So even Dr. Masaki shared with us that she has geriatricians who come through our strong geriatrician program, and we don't have too much of a shortage of geriatricians here in the state. At least at minimum, we could always use more, but at minimum, we're not too bad. But she's telling us that she's had geriatricians who graduated and want to stay here, but there's no job opportunity. So this is something that the Hanai Memory Network could make sure that we're retaining these people that we're training and want to be here. And same thing with the neurologist. There was a neurologist who specializes in cognitive neurology, and they were at Hawaii Pacific Neuroscience. They went to the mainland to do their residency or something like that, and they wanted to come back, but they wanted to specialize in cognitive neurology, but there just weren't any jobs. So they ended up kind of being more in the research area. So we know that there are people who want to be here, but the way our system is set up currently clinically, the jobs just aren't here. So we are seeing some shortages, but not extreme. But we could definitely use more to make our system more robust, especially as we increase early detection through things like the public awareness campaign that EOA put out, which is really drawing attention and getting people to start asking their doctors questions. So we're going to see more and more people who are interested in this and want to be treated, and we got to make sure that we have the capacity on the back end to do it.
Yeah, thank you.
Okay.
That's interesting.
Any other questions? Nope, hearing none. Colby, very helpful as always. Really appreciate it. Do you have any questions for us?
Oh, just appreciate all of your work and getting together or convening this group to really fight for these important issues.
Thank you, Kobe. Thank you.
I have to put it in
And
the
I'll
chat.
stay on just for a bit, just to get the link and put it in the chat.
Right there.
Yeah. No, that's not it, but thank you.
You're
Yeah,
gonna you're gonna put the website in for
for all of us. Yeah.
Before one.
the C4 Watch?
Yeah.
And then Kobe, I know you'll give it to us, but the bill numbers, when they actually get assigned, you can send those to us too.
Will
So I
do.
know Barbara and us we'll hear that, but okay, thank you.
Hey, thank you very much.
Did Daintree want to say something now?
Why don't we
Do
do
roll
roll
call?
call and then
Okay.
we could ask for
Okay.
a motion to move Daintree in since she's on the, yeah.
So we're going to then, and you can stay on if you want, Kobe, for the meeting, or I know you're busy. So we're gonna start the meeting actually 10:25, just for the record, and then we're gonna start with roll call. And Jason will take that.
All right, roll call. Oki'i Balaz.
I think she's.
She was there and she had to
online.
go to the 10 o'clock meeting and she's coming back probably for.
Oh, okay.
No.
All right, William Kinaka.
Here.
Yep. Stephen Lung,
Here.
Sarah Medeiros,
Here.
Shelly Ogata,
Here.
Susie Schoberg, Marilyn Seeley,
Here.
Barbara Service,
Here.
Gary Simon,
Here.
Rick Tibor,
Here,
Charlene Iboshi, Joanne Kealoha,
Here.
Roberta Murray,
Here.
Kathy Wyatt, Sarah Yuan,
Yeah.
Emily Ishida.
We're
Uli
next are at a
Ikuda.
meeting right now.
Okay, okay. All right, it's everybody else. Okay,
Okay,
Okay.
Jason, before you go on, I think you should include the two guests who are here,
Oh.
Leslie and myself and the director. We
Okay.
don't have her down there.
all right. So Leslie and Beverly
And me.
and Caroline.
Okay, sorry, yeah.
Thanks,
Thank you.
Jason.
all right, well, we definitely have quorum. I guess, do I have to do the housekeeping every time?
No,
Okay, all right, so. Our first, do you want to have Daintry say something?
well, no, I
Okay, she's
think you
busy.
just ask the members if we could. Someone could make a motion to adjust the schedule and we could have Daintry just speak briefly on the, yeah. Just, I can't ask it, if you just,
So if we could have a motion to adjust the schedule, we have Daintry joining us that would like to share some information with us.
yeah. Yeah, oh, thanks, Shelley.
Okay, so Shelley's motioning,
Yeah,
okay, everybody in favor?
okay.
Okay, anybody object?
We can have Daintry.
Okay, Daintry, I know you're gonna be busy, but you wanted to share some stuff with us, could you?
I actually have it.
Okay,
Yeah,
do you have a
folks.
second to do that? So that's this one here. This is, thank you, related to community care, foster homes and housing access for individuals with intellectual disabilities. Correct? Okay,
Correct. First and foremost, go Ducks. Okay, now moving on to what we're here for. So what I would like to talk to you folks about is the community care foster family homes. People were concerned about what is the purpose of it and why are we doing it. Sorry, guys, I'm just bringing up my legislative priorities to look at it. All right, so what it is the reason why we have requested that the community care foster family homes be able to accept individuals with IDD, intellectual or developmental disability, is for aging in place. There's two reasons, twofold. First, individuals right now in an adult foster home, what happens is if they are deemed to be too medical, they are removed from IDD and moved into the 1115 to go to a community care family foster home, which we don't agree with because we are strongly supporters of aging in place, and that should be able to happen. We've been working with Department of Human Services with Maddie Silverman about 14 years on this about how we can support both populations. We already do this in our adult our care homes. Sorry, our adult care homes are already do this. We have expanded arches, adult residential care homes, and they serve both populations. So it's nothing new. This is a smaller. And when people first heard about this, it was like, sure, why not? But then people got nervous and said, wait a minute, we're going to put IDD in all of our care homes for the Kapuna, and now where are they going to go? They're going to be forced to live in institutional type settings. What's going on here? So I want to reassure you folks, it is not like that. We have enough homes right now with IDD on Oahu. We have vacancies and everything. It's actually going to increase beds for individuals. So our IDD foster homes have 2 beds. if they're able to convert to a community care family foster home, they could have 3 beds. We've had our IDD caregivers ask they would like to be able to care for a senior because they have friends of and saying their mom or their dad, they need a care home of some sort. So they want to be expanded to be able to take one or the other. And it's not a mandate. It's not saying everybody who has a community care family foster home must take this person or that person. It's only increasing options. It's just increasing beds and increasing an option. It's not taking away from anybody. We're not going to ask to remove IDD homes or remove CCFHs, only do it this way. It just gives the caregiver an option if she wants to become duly certified, if she wants to go to training, or if the caregiver wants to go to training to be able to take this from this waiver, the 1915, or from the 1115, as well as one private pay. So when I was talking to John yesterday and Caroline, they're like, they're still a little nervous, like, hey, but how about this or that? You can't read the future, but the good thing is that we being the state controls the certification. If all of a sudden we notice that, hey, wait, we're losing beds, we can stop it immediately. So it's not like something that will just continue. If we miss something, we could stop it. We could pause it immediately and say, hey, let's take a look at this. What did we not foresee? Go ahead.
Marilyn has how does this affect the need for training? What, is this an old question? Is there an old?
No, that's the new one right now.
Okay.
1032.
Sure.
How does it affect the training for availability of?
Yeah, just how does this affect the training? Because we don't want, people to be inadequately ready to take on a different kind of client population.
Oh, sure thing already. So, Marilyn, actually, the community care family foster home individuals, they get a higher level of training right now, and they will continue to. So it isn't, we're not going to be introducing individuals that they would not feel comfortable with accepting. They do have what's called visions training. It's a 40-hour curriculum that they could take to be educated. But the individuals that they would, like, let's say the case manager said, oh, here's an individual. And, oh, yeah, they blend in perfectly with our family. So they'll have a choice. They'll get a visit with the individual, see, and make sure they're fit and such. So the training itself, if they choose to do it, it's 40 hours additional. And then after that, it's just they'll keep up, like I think they have one training a year to keep up with their certification. So right now, our community care foster caregivers actually have a higher level of training than our IDD caregivers. So the IDD caregivers, if they want to become, which we hope they do, in talking to them, we have there are approximately 300 IDD foster homes. We're looking at each of them, or half of them wanted to get, that's 150 more beds open. So we're excited about that. Plus the IDD, they have about 300 person wait list on Oahu who want to become caregivers. So if we could work together and get that list and they become community care family foster homes, that's another way to look at it. So I just see this as a win-win. And again, we have control over that. So we could, if we could slow down, we don't have to go fast at it or something. It's just giving the option. And we already have that option already with our, like I said, our arches. And also people today have left the 1915 and moved into the 1115. That has happened already. I think about a dozen. I think they said about 18 individuals that has happened to. So we just want individuals to be able to be able to age in place and not have to move out. And so that's what I'm looking at. But
So
again,
Andrea, then I've also noticed with developmental disabilities that folks are actually living longer. So
Mhm.
We have one Kapuna that are actually developmentally disabled, which is a big part of this picture here.
Yeah.
Correct?
Mhm. Correct, very, very good. And then also we have individuals that saying, I don't want to go to a day program anymore. I'm tired. I'm 73 years old. I want to just stay home and every once in a while go out. And then what they'll say is, well, then you have to leave. You can't live in that home. This home, you have to be eligible for habilitation, rehab services. You increasing your skills, maintaining them, going out. So individuals just aren't allowed to do that trajectory of aging in place. And so again, we see this as a very small population, but I think it's needed. And to be able to share resources. And also when it comes to Medicaid, many states have stopped, many being 4 states, guys, 4 states stopped their 1915C and they moved everybody into the 1115, which, if that happened to us, that would be kind of very scary because it's going to be lickety split. But if we already are looking at how can we mesh and work together to utilize services together, I think it's just going to help us in the future. And that's what this bill is about. Increasing residential options for individuals.
Any questions from anybody? Dantry, sounds very good. Can you, when the bill numbers get assigned, let us know?
I sure will. We're going to have 6 bills and then we'll share those all with you. I don't think I'm on the agenda to share all of our bills with you folks today, but I'll make sure I share that all with you folks.
Is that one a new one that you're talking about right now, or is that a reintroduced one?
No, this is a brand new one.
Brand new one, okay.
Mhm.
All right, thank
Well,
you.
approximately how many people are involved?
How many people are involved, Bill asked?
Roughly.
That was Bill. Identify
Sure.
yourself.
Hi, Bill.
Okay, yeah.
Yeah. Hi, Bill. So right now, we have, let's see, there's approximately 300 adult IDD homes. That's about 270, I think, individuals live in an adult foster home under IDD. So that's what we're looking at, those individuals. And the last 5 years, I think we've had 18 people move over to the community care family foster homes. So 18, I'm looking at maybe 5 a year. Maybe it looks like. So it's not like our IDD population on Oahu. I could speak very strongly for. Neighbor Islands is always difficult to find placements, but they're not looking for placements. It's just a matter of being able to age in place.
Thank you.
Okay.
Thank you.
All right, Dantry, go Hawks.
Go Hawks. Bye, guys. Yeah, I know. The Seahawks, I'm so excited. And the Ducks, I love football.
I had to squeeze it in somewhere. Okay, so that's a lot on bills and a lot of presentations, more than usual.
Good information.
Good day, I think. So let's the minutes from December 5th. Everybody okay with that? Can someone motion to approve it?
Questions?
Yeah,
Thank you. So, the minutes on the bottom of page 2, it says that this is talking about the primary care protection bill. You had said that we would add that to our agenda to be considered. Is that, so on our agenda, is that under the,
so we don't have that because we just received it and we received it after the deadline to actually.
other bills? Is that under section 8 where you, in our agenda where it says other bills? Is that where we're putting that?
Can I help
Please,
with that?
yeah.
I think for the minutes, we gotta keep it there, but then maybe what we need to note in this meeting's minutes would be that we got the information after the agenda went
Yeah,
out.
we just received.
Is that what it was?
Yeah.
So that maybe we can table it for the,
So we asked her to
Next
send information to the
agenda,
doctor and
yeah.
we just received it, but it was after the time that we had
yeah,
to
so we
submit
had
this.
to submit
So,
the agenda. That's why.
You
it
are
wasn't
correct. So
on.
we need to, we'll add that to the next meeting. Because now we have it.
Okay,
But then does that fit under what Sarah's saying
Oh, I see.
on the agenda?
Yeah,
on the
On
agenda,
section 8,
Oh, it was on, This
No,
one's,
says
on
other bills.
sorry.
On section 8, there's
Uh-huh.
other bills.
Oh,
So, and in the minutes, it does describe
Oh, here-
all of
oh,
the
it's
things
two.
that he said was going to be in the bill.
We have 2/8.
oh
So,
no. Sorry, we
Oh,
have-
yeah, there's 2 8.
sorry about that. We have two eight.
Yeah, I wasn't reading it, okay.
Okay, sorry, I didn't have a chance to see.
How does that work then?
Let's see, so it's in, so sorry, which eight is it in?
The first eight.
Other bills.
So folks,
our agenda. for
I would like to
today-
suggest that we send you what she sent us, if we haven't already, because we just received it. So you can look at that and then next time we'll talk about that. So one thing that's happening here today is we had 3 speakers, so we've taken up a lot of the time. Go ahead, Evan.
You have a motion on the floor about the minutes, okay? Sarah is making a question to the minutes.
Right.
So let's
gotta
address
do
Sarah's
minutes.
question to the minutes. Okay,
Okay.
Sarah, cause you're saying page 2
At
of
the
the
bottom.
minutes.
Page 2 of the minutes says what will be added,
Okay, what
To the
part of
agenda.
page 2?
of the
The
minutes.
last,
It's the second, it's the last bullet.
The
On
last
page
bullet.
Chair
2.
Haber says that the proposal will be added
Added
to
to
the PABEA
the-
legislative, okay.
In January or February, posted draft of the bill, blah, blah. And so on our agenda, in that section 8, it has, the bullet says other bills. So was assuming that that is where we will discuss that,
Okay,
especially since.
so we have cancellation notice for long-term insurance, that one, and then other bills.
Yes, especially since we have this long discussion under discussion comments and so on that describes the bill. My questions.
Yeah.
it's a dual question.
Yeah,
I think for the purposes of the minutes, so that's what you're saying.
Yeah,
Vivian.
So let's
Yeah.
get minutes first, and then go to the agenda part. Okay, Sarah, so Sarah's
Yeah.
question, I hear her, is that her question is, the minutes say that this will be on the agenda for next month, and it is not. So is this correct or not correct? In the
That's
minutes?
my question. Is that correct? Or is it reflected right here?
so you have,
I assumed it was reflected right here where it says other bills.
yeah. You said it's good.
So that's
It's a
what
you
you
guys-
clarification.
clarification.
Clarification. But for the purposes of the minutes, it was discussed last time, so that would be a.
So it was a presentation last time, and then she sent more information. So what I would suggest is that we will send the information. Did we not send the information when we got it? So we'll send the information that the doctor sent us to the legislative team to see, for discussion in the next meeting. Cause we haven't had a chance to review it all. So you guys can review all of that, and then we'll put that on the agenda for next time to talk about that as well. The other bills that we're kind of referring to really is the caucus top 5, but we're gonna hold off on saying anything about that right now.
Minutes.
Yeah.
So Sarah asked the question,
Mhm.
so your answer to Sarah is, yes, it was addressed, we will keep it in the minutes as recorded.
Right.
Yeah,
Okay,
okay.
so now you
Yeah.
take your vote on.
Were there other issues?
Are there
Oh,
other
yeah.
edits?
There are
Other
yeah,
discussion?
That's a good question.
Okay.
I have another question, but Shelley has a question. No.
Go ahead, Sarah.
Okay, I wanted clarification over something that somebody had said on page 5. No, wait. Oh, Carla, it's the number 1 and page 5 at the very bottom. Caroline requests that PABEA support the agency's quote, stand down approach for the upcoming legislation session due to severe capacity constraints and difficult fiscal environment because we're struggling to fill vacant, so on, so on, so on. So the question is, we're being asked to align official testimony with this position. Could you clarify what you mean by
Yeah, I think,
stand down approach? I don't understand.
and I don't wanna, yeah, actually, I did say that. I think I was just, it was more cautionary in the way it's written. It sounds like it's a directive, right? Yeah, so what was meant by that is, just be cautious as we go into this session due to the fiscal constraints, and that's how I should have said it and not used the word.
And we should edit that.
But I did say it though.
He said
You
it.
know what, just leave it alone, because now you have clarification as to what the director really.
Because I
said.
did say
Okay,
that. I
so,
don't
you
wanna-
know, okay, might as well keep it, because that is.
Okay, I
But
just,
no, that's a good, Sarah, I appreciate you.
I just
you know,
wanted to
highlighting.
clarify with that
Yeah.
minute.
So then that'll be in the notes for next time. So in a sense, follow up, yeah.
Okay.
Is there,
Do you
okay,
know- Hang on,
okay.
Hold on.
okay. You don't need to clarify unless she's making an amendment
All
to
right.
change the wording in the minutes.
Okay.
Okay,
Do we
and
want
at
to?
this point, I understand Sarah to say, you correct me if I'm wrong, that she will accept what the director said via the explanation that the director just gave you.
Correct.
Okay, thank you.
Okay, thank you.
Okay. And then with that, are we good with the minutes? Need a motion to approve?
Oh, but thank you,
December
Sarah, for bringing that. I appreciate it.
I just want to make sure, like, we don't want to add a comment or clarifying comment. Because if we leave it like this, it's a little confusing.
I see what you're saying.
Then you would have to amend. it.
Can we
You
amend
would have to
that?
have something, you would have to have the language to correct it today. Okay, for it to be amended. Okay, so
Right.
the other possibility, Rick, is that you postpone
Yeah.
the acceptance of the minutes to the next, committee meeting in February. Okay,
Okay,
so Shelley, if anything, that should be your recommendation now. To, postpone the acceptance of the minutes till your February meeting.
and then
where
you
would
like,
it show that it was
Oh,
clarified?
that's in the minutes now.
Yeah.
And you folks, after this, you folks clarify it, because right now, because you've got from now till February, that's why you're not accepting the minutes as they are written today. In February, when you come back to it, just that one part is what you are going to amend. Okay, and
And
that's
we
the
have a
first minute.
recording, maybe we should go back and.
Okay, and that's the first minute that Rick will approve in February, will be this one here, because you're amending it. And
so
that
we'll approve that,
new
then we'll approve
language will
January.
be what you folks present that day as
Okay,
the amended
yeah.
language.
It's a good idea.
And that's up to the team. Would you like to motion to do that? To table so motion to table the December 5th meetings. Waiting for an amendment on the standby.
As we wait for them, sure.
Okay,
So moved.
okay. Do we need a second on that?
I'll
Just a
second
moment.
that.
Okay, all in favor? Anyone opposed to, or other comments? Okay, hearing none, we will table the December 5th minutes until the February meeting. When we'll have the amendments added to it, okay? So that's that. Next on the agenda. Where am I at here? I'll find myself. So we've had guest speakers and we started with PAR. And we've had speakers as we've gone all along here. I do have a couple other ones to suggest, but I want to hear from the committee. Should we continue to have guest speakers at this point? And here's my thought. Maybe one more round, and then the bills are gonna all be introduced, and we're gonna get really busy with the bills. And so if you would like to hear one of the other bills that's coming forward, or from a couple other people, we can always set that up. So my first question to you is, should we have another speaker for February? And how does the committee feel about that? And you out there in Zoom land, you can chime in as well. We see the.
There's a lot to talk about.
Yeah.
I like the speakers very much, and if they're germane to our priorities, I think that helps inform us. And also, by that time, we'll have a preliminary idea of what's going on, so I like that.
Okay,
I personally, I think we have a lot to talk about and not much time to talk about it.
today's kind of an exception because we had two speakers, because that's what you
We
guys,
had three
we ended up
speakers.
with three. Yeah, typically we have one. And so in the past, what Barbara, I guess Barbara, Gary, some of us, if you recall, we've also had speakers as we've gone along because they come and update us as to what the changes are that go on or what their hopes are and what's happening. So the speakers, you know, from time to time, it's nice to hear back. This is where this bill is right now. This is what we could use help with. This is what we've seen. This is what we're facing. So we don't have to read between the lines. And there are a couple other bills that are going to be introduced that we haven't had speakers on just yet. So I guess my question is, should we continue? That's the first question with speakers. And then the second is, I have some suggestions in here for who could be our next speaker.
Could,
Mhm.
Rick, could we table that until after we talk about this other? Our focus, our legislative focus?
Okay.
Then come up with it, decide based upon, we're on what is in the agenda.
Okay. Would everybody like to do that? Move on and come back to that topic?
Today,
Yeah,
yes,
yeah. Okay.
okay.
So other bills were considered, so where are we at here then? Well, whether to recommend. So I'll just go into, so we were going to vote on whether to support the 5 bills that the Kapuna caucus selected. There's been a shift. So, and it's not on the agenda here as such, but I'm just gonna share the shift. Because we don't know what the 5 are going to be until after today's meeting, because the 2 bills that were in question about being county bills were in fact tabled. And so the next 2 bills, which is the Kapuna Rent Supplement Program, making it permanent, and the state planning for hearing loss task force are the next 2 bills in line. I talked with Senator Morawaki yesterday and with Alex. We need to wait for the Kapuna caucus to meet to approve that before that's going to be what it's going to be, if you will. So just like with the notes, I would like, so one thing we talked about last time is once the bills get introduced, we would like to, for our legislative committee meeting, to have an emergency or a quick meeting to go over all of those and pick which ones we're going to support. We've heard now of some other ones today that aren't on this list as well. So my ask is, I would like to suggest that we table until next time, the Kapuna caucus 5 bills, because we still need to hear what those are actually going to be with this change that's going to happen this afternoon. So they're going to talk about that in the meeting today. And so without the Kapuna caucus chiming in, we don't have it official just yet. Okay? So that's the 5 Kapuna caucus bills. I'd like to hold off on those.
Did we skip the, sorry, Rick,
Mhm.
did we just skip number 4
Maybe.
on our agenda?
6.
I'm sorry, number 6.
Oh, okay. Yeah, no, I had it turned already because, yeah. So that's suggested speaker. So number 6 on our agenda is proposed legislative focus. So the suggestions for the committee focus on 3 areas: food insecurity, SNAP, etc., which we heard a lot from Rep today about that. Shelter, high cost of living, affordable housing, healthlessness, which we also heard from her on. Safety, access to healthcare, Medicaid, hearing loss, fraud, scams, disaster, emergency preparedness. Okay. So what would you like to do with that?
Well, can I say something?
Yeah, no, I'm
Okay,
asking.
sorry.
Yeah. But so identify yourself when you.
Yeah, so
for the notes.
Sarah Maderas.
Thanks.
So the idea is to, because there's a whole slew of issues that concern Kupuna. That right now, given the fact that the governor specifically has asked that the legislature contain itself to things that or not bring out anything new. Specifically said, let's focus on the programs and issues that really concern the state for this next fiscal year, and perhaps even the fiscal year after. And there was quite a very good report in Civil Beat. I don't know if everybody read that, but it talks about the governor's proposed state budget, which I believe is coming out today. And so anyway, if we are just to focus on three main areas and try to limit, more bang for the buck, basically, by getting behind those three areas and not spread ourselves really thin, because as Rick, as you pointed out, a lot of people have their pet project or what they're passionate about. But if we really just for this year and next year, if necessary, focus on these three main vital issues for our vulnerable seniors, and their families for that matter, because we know that families take care of them. We're talking about basically a very large portion of the population in the state. And that we can make a bigger impact if we're not spread really thin. So that would be just a suggestion that we focus on those three areas. And when I said safety, it really means it's / healthcare. It's just providing basic services. That's all I really have to say about that.
Anybody want to chime in on that?
So is the motion to?
Oh, we have a motion. It's just a discussion right now.
Okay.
So for discussion,
Have a motion so that we can have a discussion?
Yeah.
The
Okay.
motion is for our committee, I'm trying to get it. The motion is for our committee to focus on three main issue areas for this legislative session. Is that what?
For vulnerable seniors,
Right.
because some seniors are not as vulnerable as others.
Right.
And I think it's important to use that word.
Okay.
and so for those that might not have the notes in front of us, the three that Sarah is in the motion are food, shelter, safety, which also includes health. Should those be the three areas, right, Shelley?
That's what I'm
Okay.
getting. Yeah.
So the motion on the floor is to have those three be the areas that our bills fall under: food, shelter, safety, and health, right?
For vulnerable seniors.
For vulnerable seniors, for our Kapuna. Is there a second on that?
Well, I second
Seconded, but I can't vote.
Yeah, well, okay, so Shelley's proposed, made the motion, and Sarah, so please identify yourself. Sarah is actually seconding it.
Yes.
Okay, so now it's open for discussion. So what do people think about that? So let me ask this, so, because I did just do I talked about the 5 potential Kapuna caucus, do they fall under those categories? Right, so just to name them for the record, and now they still have to vote on this change, so I'm gonna name it as the change. Family caregiver tax credit was the top vote getter.
Maybe.
Well, I mean, I'll just name them all, then we'll go back, okay? And then Kapuna Aloha program to expand primary care and home health services. And then the third one is statewide dementia training for first responders. So this is dementia training, statewide dementia training. Freeze primary residence tax, oh no, that's got cut. So the next one, because of the two county ones that were on there, Kapuna rent supplement program, making it permanent. And then the state plan for hearing loss task force. Do those fall under those categories? Okay. Okay, let me expand then. Today we had the presenter from, it's Representative, Lisa Martin, to her programs that she, or her bills that she talked about. Would those fall under those categories? Probably, right?
We have to see.
Oh, three were.
I wrote them down.
Long-term care financing bill task force,
Hawaii Benefits Hub,
Hawaii Benefits Hub,
and the thing about DHR.
increase amount of contract, is that reimbursement? The funding,
It's our contracts.
yeah. And then she added a fourth one, increase volunteer opportunities bill. Right? Do they,
That's part of the hub.
That's part of the
though.
hub?
Yeah, it's part of the hub.
Okay,
yeah.
she
They
just-
can either do work,
Oh,
they can do
okay.
work, or they can do volunteerism or something like that.
do those all fit,
It could.
right?
Yeah.
Okay, and how about then what Kobe presented? So the Anai Memory Network. University of Hawaii's Alzheimer's Research. And dementia training for first responders.
Probably not.
I think that one's safety.
If we're trying to focus on what's immediate, the immediate need
Mhm.
for 2026, 2027. I'm not sure.
Which ones are you not sure of? All three?
Yes.
Okay. I would disagree. Having a mother that passed with Alzheimer's and seeing what happened. Yeah.
Question is, will the governor tap into our rainy day fund?
You know, I'd also say that there's a lot that changes every day with what's happening out there. So, how we hear his budget, I'm not sure. Cause there's a whole nother side to what's being proposed that we don't know just yet.
Right.
And not to bring the Fed level in here, but it changes all the time, so. But to go with what you proposed, so it's, any other discussion on this from anybody? Okay.
Rick,
Gary?
what is the motive for these, for putting them in these three buckets?
Yeah, what is your motive? What is the motive?
To
What is the goal? I mean, how do we benefit from putting them in these buckets?
I think what it does is we'll focus on what we need to do, since we can't control what's going on with the feds, right? But we can control what's going on with the state. And our immediate response to what's coming down today, it's January,
And the connection to our state plan.
and our connection to our state plan.
So PABEA state plan, which we'll put
Yes.
on the,
Mhm. My state plan on aging for
State plan
4
State
years.
plan on
Yeah.
aging.
I mean.
Right.
Your state plan, that PABEA's, yeah.
So next time.
I have it to add, actually.
So we can control how we respond. So usually we're thinking long-term down the road, we can have this, but I think what we need to do is focus immediately on what is in front of us.
So I don't know if this fits into this, but most of us have found it takes many years to pass an actual bill and then many more years to actually implement it. So by the time a bill that we're actually doing actually happens, sometimes everything's gonna change. I'm not saying that, I'm just putting that out there just from the experience of trying to pass bills for a number of years.
Right.
It doesn't happen like, boom, it passes. We, Alzheimer's Association, we passed bills that then took another 3 or 4 years to actually make happen. For a number of reasons.
I just think we should not try to get distracted by this a whole range of things that need to be addressed. that we need to just really think on what are the primary, most important things. We brought it up about, the hierarchy of need, and I think that's what we really need to focus on.
Mhm.
That's my opinion, just being out and about.
Okay. So Sarah is referring to the Maslow's hierarchy of needs, safety and shelter being number one, food and security being number two. And then you move on to relationship and onward.
So I guess
Okay.
basically we should concentrate, Bill Kidaka, on
Thanks.
funding the current programs that we have, not start new programs. Like you say, it takes years to be, and,
Right.
yeah.
To prioritize what we've got, essential
What we
services, right?
have right now,
Okay.
money is the necessary thing that drives the car, and
Mhm.
why talk about new programs when things are so up in the air, so unpredictable? So just focus on getting as much of the money that we can for each program that's already existing, that's helping the seniors. Instead of talking the new programs
Okay.
for this year, coming year.
All right. Other discussion, folks? Anybody in Zoom land? Gary, does that help?
No, no, I mean, I don't, I mean, I understand that, I don't, because ultimately what we're focused on is aging related issues. And, whether we segregate them or sort them into the three areas, I don't know how that makes us more efficient. But I'm not, in the end, I'm not objecting to it. I'm just saying, okay, we put them in the three buckets.
Have a
Oh.
hand in the Zoom.
Well, what do we gain from it?
I think what we get gain from it is that we can prioritize.
Okay, Charlene has her hand up.
Okay, but maybe we
Go
should,
ahead.
yeah.
Go ahead.
Charlene Iboshi, community member, not voting member of PABEA. Just a comment. I like the idea of trying to organize it to focus on those three areas. And maybe not right now, we don't have it all organized, so we don't really know because they haven't introduced all the bills yet. We don't know what the priorities are going to be based on what you said about the Kupuna caucus. So I like the idea of kind of putting them in little buckets so that maybe, for example, say I'm interested in the houseless community because I belong to a board on this island. I might say I can help monitor that and push this information out so that it would take some burden off of some of you. You know what I mean? So it's like if there's an interest area within this group, then maybe they can say, I'll take care of this bucket. So whatever comes up, Christina is sending us a lot of information, but it's hard to monitor all that. And
Right.
as all of you know, at the end of the day, there's only like a certain small number that come out at the end. But if you have someone just monitoring one bucket, it's much easier than trying to monitor the whole thing. That's my thought.
Yeah.
Thanks.
Okay, thanks.
Yes,
Anybody else?
I'd like to agree with that.
I think monitoring one of these three buckets is, Christina does a hell of a job, but realistically, it would take multiple people to observe the safety bucket.
Yeah. That's a big bucket.
That's a huge bucket. Disaster emergency preparedness alone. You have 20 or more bills.
Yeah.
To monitor.
Yeah.
How many members do we have to monitor?
I'm sorry, what was the
How many
question?
members do we have that we're talking about monitoring?
Eight.
for legislative.
Yeah, eight, I think,
Yeah.
yeah.
Yeah. Yeah. Yeah. So again, several of us are gonna monitor the ones that we're going to monitor. I look at this list and we put it out there a couple meetings ago. I think most of the bills we've talked about fit under them. As far as how you prioritize it, I mean, that varies. So the hope here would be that folks, find bills that they can actually support, that work going forward. So we have a motion on the floor. I want to go forward with that. Is there any other discussion on this motion? Okay, so the motion has been, Shelley, you want to repeat it?
No.
Nope. All right, anybody need to repeat it or do they have it? All right,
I don't think I can see it the same.
well, the motion is to prioritize bills that fall under the food, shelter, safety realm as the three main focus areas.
For vulnerable seniors.
For vulnerable seniors, we don't have that written here, but okay, for vulnerable seniors. Okay,
Friendly unit.
so all in favor? Say aye.
Aye.
Those opposed? All right, hearing none. Then we will work within the food, shelter, safety realm as far as our bills. So I already shared that there's a change coming with Spapuna caucus. We're kind of going over a little bit over time here. And then the other bills, we're gonna add, Dr., what was her name? Anoka? Well, the information we got on the presentation from last year, we'll send that out to folks. And then I'm gonna go back to, do we wanna I wanna wrap this up. So do we want to have a speaker next time? So my suggestion is one of the bills that's gonna be talked about, and if you were at the Kapuna Caucus, you heard about it, it's the state plan for hearing loss task force. So Tori, who has a nonprofit, here for the number 4, Hope, you can look it up. She's a great presenter. So she's put forth a bill that now the Kapuna Caucus is gonna talk about supporting. I'd like to bring her here. As you know, it's, if you wanted to call it a pet project, but it's not a pet project. It's actually a passion for me. The hearing loss thing just doesn't get heard. And it is a huge issue. And Tori lost her hearing during COVID and has a cochlear implant, and she's living with hearing loss and has a very incredible program and has pulled together a remarkable task force team. Kobe's on it, I'm on it, but Rick Wood and a number of folks that are on it. I really want us to understand what we're looking for. So we're backing off of the $1,500 per year because we need, so 2 years ago, I was told we need more research specific to Hawaii. That's what this task force is about, to take a look at Hawaii and what the needs are. So if you don't mind, I'm just proposing that Tori could come and speak. That's just one of my suggestions, but open to anybody if you would like.
May I suggest that we table that until next time and not have a guest speaker because we have a lot to talk about next time?
Okay.
Because we will have bills and we will have a budget
Okay.
and so on.
So I'm gonna nudge just a little bit further because we've heard about people from folks with every other bill that Kapuna Caucus is being proposed. The only one we haven't heard about is the hearing loss one. And I'm concerned that not hearing her story and why we're promoting a task force would then be not maybe voted on because people haven't heard from her. We're going to do, once the bills are all introduced, and correct me if I'm wrong, we have until the end of January, right, for the bills to be proposed. So once they're proposed, before the
End of January, and then our next meeting is
February 5th, if I have the date right?
I think it's the 5th, yeah.
So that might jive right with when the bills are introduced. That might be fine. That's,
Thank you. It's 6, yeah.
is it 6?
6.
Okay. So there's 2 questions. So,
Could you add the one thing about, that, that hearing, the plan is gonna be under, Dr. Lewin's looking at, so
The task
So it would
force?
be, yeah, it would be. under
Yeah, so
the-
SHPA and High Five are going to sponsor, they're gonna be helping with this
To develop
task
that.
force to develop it. One's gonna hold money, others gonna, so we have a whole team of folks. We've done a lot of, Tori and I have gone around, and talked to a lot of folks around.
Is
All
Community
of this.
Caucus gonna,
Yep,
talk
Well,
about?
so one of the bills to replace the two bills that are county bills, what
Then we don't have to hear it again.
Are they gonna bring it up today?
all they're gonna do is talk about the two bills
That have
Th-
been
that-
replaced, right?
replacing. I've already asked, so they're not gonna have another presentation.
Mm.
So basically, Tori had like 2 minutes to talk about it. You haven't heard the whole story. But it's up to this committee. So,
Rick, this is Roberta. You know,
Yeah.
for as long that I was personally involved with PABEA, I have been very interested in the hearing bills. And so I personally would like to hear from Tori, but that's just me. I'm throwing in my
Right.
2 cents.
okay. Anybody else? For sake of discussion? So what we're talking about is whether to have a speaker next time or whether to table it until March. Next time, Sarah is right, we should probably start knowing some of the bills that are out there, and we do need to vote on what we're going to be doing. Those of us that have the bills that we're gonna follow, we kind of already on track with that, but those that are going to select some bills, they're encouraged to select some bills to follow. You know, you're still, listening for what's out there. So, do I need a vote? I don't know what I said. I don't know how to do it. For Tori to speak or not to speak, or a speaker for next time.
I think you need a motion to vote on it.
Okay,
Yeah,
and I can't motion, right?
yeah.
No,
No,
Chair cannot make the motion.
Yeah, I can't.
Somebody who is a PABEA member needs to make the motion
mhm.
that, to postpone having a speaker until another date.
Can you guys hear what Beverly's saying? So at this point, we need a legislative PABEA meeting or a PABEA member to motion whether to, either to motion to have a speaker next time or to table it until later.
Actually, you
Barbara
can
has
only
her
do
hand
one.
up.
You can only do one.
Yeah, no, I said either.
No, you cannot do either.
All right. Barbara, how would you like to motion?
Yeah, Barbara
I
has
would
her hand
like to move that we do not have a speaker at our next meeting because we've got a lot to do. While I am interested in hearing from Tori, I think that needs to wait until February. So that's my
Okay.
motion to not have a
Till March.
speaker at the February 5th meeting.
Okay, or 6th, okay. All right, so the motion, is there a second?
This is Shelley,
Okay.
second.
All right, all in favor of not having a speaker in February?
Aye.
Aye.
Okay. Those who would like a speaker in February? All right, motion passes. So next meeting, we will not have a speaker. All right. Okay, I think I've covered everything, right?
Yeah.
Oh, so the last thing on here is I've become part of the Hawaii Falls Prevention Alliance, and they're doing a survey. They're having folks fill out a survey on, this is part of their,
And Sarah put it in the chat too.
yeah. And so I can also email it out too.
Well, I asked Sarah, but I think she had to go if she wanted, Josephine to just send it out to all.
Yeah.
So maybe we can just table that and
Okay.
send it out to all.
So we'll send that out for everybody. So that's, you can fill it out and you can also share it with other folks. Okay. So that is
No pleasure.
everything that we have. So, okay. So our next meeting will be our next meeting.
February 6th.
So we will adjourn at 11:20. Thanks, everyone.
How about a photo? Sorry.
A photo.
Yep, here, just smile.
Oh.
Okay.
Certainly nicer photos. Okay, I'll bring my.
And whoever's in that room, okay, great. Whoever's in the room,
Smile.
I can't see you, but smile.